Now, everyone knows about the famous hip joint and knee joint, but not many people like to talk about the lesser known tibiofibular joints. The tibiofibular joints are two joints of the leg, one superior and one inferior. This doesn't mean one is better than the other, just that one is lower down. Right below the knee joint, there are the leg bones, namely the tibia and fibula, which are connected by a superior tibiofibular joint and an inferior tibiofibular joint, which is a component of the distal tibiofibular syndesmosis, as it is the distal end of the syndesmotic or fibrous connection between the tibia and fibula. These joints have minimal function in terms of movement, but play a greater role in stability and weight bearing. The superior tibiofibular joint is a plain type of synovial joint, which allows the involved bones to glide over one another to create movement. This joint is located between the flat articular facet on the fibular head and a similar articular facet situated posterolaterally on the lateral tibial condyle. As expected, the superior tibiofibular joint is also surrounded by a joint capsule which attaches to the margins of the articular surfaces of the fibula and tibia. This joint allows slight gliding movement during dorsiflexion of the foot. The tibiofibular syndesmosis, on the other hand, is a compound fibrous joint. Basically, it represents the fibrous union of the tibia and fibula by means of the interosseous membrane, which unites the shaft of the bones, and the anterior tibiofibular joint, which unites the distal ends of the bones. Speaking of which, the inferior tibiofibular joint, or distal tibiofibular syndesmosis, occurs at the distal ends of the bones where the rough triangular medial surface of the fibula articulates with the fibular notch of the tibia. But remember, as a fibrous joint, there is no joint cavity. Instead, the bones are held together by strong tibiofibular ligaments. The deep interosseous tibiofibular ligament, which is continuous superiorly with the interosseous membrane, forms the strongest connection between the tibia and fibula. The joint is also strengthened anteriorly by the anterior tibiofibular ligament and posteriorly by the posterior tibiofibular ligament. Finally, the inferior transverse ligament is the deep distal continuation of the posterior tibiofibular ligament and forms a strong connection between the two malleoli. This joint plays an important role in stabilizing the ankle joint because it keeps the lateral malleolus firmly against the lateral surface of the talus. This joint allows only a small amount of movement to accommodate the upward wedging motion of the talus during dorsiflexion of the foot. Okay, as a quick recap, the superior tibiofibular joint is a plain type of synovial joint located between the flat facet on the fibular head and a similar articular facet situated posterolaterally on the lateral tibial condyle. The tibiofibular syndesmosis is a compound fibrous joint formed by the union of the tibia and fibula by means of the interosseous membrane, which unites the shaft of the bones, and the inferior tibiofibular joint, consisting of the anterior, interosseous, and posterior tibiofibular ligaments, which unite the distal ends of the bones.